Hello, everyone. My name is Dr. Erin Maruska, and this is Dr. Janet Woldt. Today, we'll be sharing a project we ran in our professionalism and ethics class with first-year dental students, where we explored how AI can be used to strengthen ethical decision-making and communication skills. Professionalism and ethical decision-making skills are not just soft skills. They need to be practiced and developed, just like any other technical dental skill. Traditionally, we have relied on peer-to-peer role-playing and classroom discussions. While valuable, these methods often have limitations. Students have inconsistent experiences, direct feedback can be minimal, accountability is low, and some students honestly just tend to goof off. So we tried something new. Instead of role-playing with peers, the first-year dental students used an AI chatbot like ChatGPT as their patient. The students opened their computer and their preferred chatbot. Most used ChatGPT. They were instructed to write in the prompt, "I would like to engage in role-play with you and have you grade my responses. I want to be the dentist and you are the patient. Here is my scenario." After the back and forth communication and chatbot feedback, the students wrote a reflection about it. Finally, they uploaded that script and chatbot feedback and the reflection into Canvas. The topics of the 5 scenarios ranged. One scenario, for example, involved deciding whether to treat a patient who is continually late. The chatbot provided feedback highlighting empathy and professionalism. This is more empathetic communication and can also improve patient future outcomes. The idea came from corporate America and how some companies are using AI to practice negotiations.
So the feedback we got from students was overwhelmingly positive, both quantitative and qualitative. We know this because we did a survey after the exercise, did a 6-item survey, and they gave us feedback and said that the exercise provided valuable feedback on their responses to patient concern, high score. Chatbot correctly interpreted responses to their patient scenarios, high score there. And students were able to effectively practice their communication and their ethical decision-making skills more so than if they were having a peer-to-peer interaction. The qualitative feedback, as I said, was also very positive. They really like the real-time grading and feedback. This generation really likes that immediate feedback. They were able to identify areas that they need in terms of their delivery, interaction, tone, empathy. And they also really appreciated this. This was a low-risk environment to practice these difficult conversations and communication without any judgment from their peers, patients, or even us. Some of the concerns that because it's AI, artificial intelligence, there was a lack of the human touch. And some students were concerned about the environmental impact in terms of the construction of the large data storage centers and how they are used. In terms of the ATSU core professional attributes, yep, it pretty much hits everyone, but most notably critical thinking, interpersonal skills, social responsibility. If you tweak the scenarios just a little bit, you can get interprofessional communication as well as cultural proficiency. So we're pretty much 5 for 5 for the CPAs. In summary, this was easy to implement. It was extremely fun. There wasn't any additional cost, no cost to the students or faculty. We had our laptops, we have access to the internet, you have access to AI, and the exercise was extremely scalable and adaptable. You can change up the scenarios to meet whatever needs you have. You can scale them to whatever level of Bloom's taxonomy you want to grade. And it works for any of our disciplines at AT Still. So thank you very much for listening. If you guys have any questions about our AI innovation, please let Erin or I know. Thanks so much. Bye-bye.